Good day, my friends. This is your doctor, Dr. Digambar Naik. Well, today I do want to say something about echo or echocardiography. As a cardiologist, I've been doing a lot of echos, and that fascinates me because just by putting a probe on your heart, I tell the patient practically what is happening inside his body the whole day. Today morning, one young man comes to me, 32-year-old, for a routine echo, for a fitness. I do an echo and I tell him, my boy, you are hypertensive, you have a high blood pressure. He says, no doctor, I've never been a high blood pressure, I don't have it, I don't feel anything and all that sort of thing. So I checked his whole thing. He had all the signs that the blood pressure causes on the heart. Your pressure is a pressure inside the heart. So what happens? Heart is the first organ which gets damaged because of blood pressure and the arteries, and then the damage goes on. After I finished my echo, I recorded his blood pressure 3 times for him to be convinced, and it was high as expected. So friends, this is echo, wherein you use ultrasound to look at your heart. And you can look at so many things. You can look at the walls of the heart. You can look at the valves of the heart. You can look at various chambers. You can see how the blood flows through various chambers. You know if particular area of the heart is getting less blood supply. You know if there are blockages. You know if there are impending blockages coming tomorrow. You can know if your heart is failed. You can know if the heart is about to fail, or you can know what various problems which can come into the heart even tomorrow. You can actually look at that echo and predict, okay, well, you can live long, or you have a short life. So much information is available today with the types of echo studies that we do. In any condition, say you want to be made fit for anesthesia, you need an echo. You want to be made fit for your job, you need an echo. You want to be fit for sports, you need an echo. In fact, in sportsmen, echo is a must. That's one investigation which will give the sportsman his complete life. There are problems sometimes inside the heart. If they are not checked by an echo, you do find these young sportsmen scoring a goal and dropping down dead. These problems could be identified. Look at the lung. Looking at the echo of the heart, you can see the condition of the lung, because the heart and the lung are interconnected. The science of echo is so well developed today that it has become subspecialties. Like you have a transthoracic echo, you have a transesophageal echo, you have a contrast echo, you have a 3D echo, you have a 4D echo, you have a speckle tracing, and you have a strain rate as separate branches of echo. Especially cancer, when you are taking chemotherapy or radiation in cancer, what happens is these drugs do affect the heart. And your echo can tell you that they are harming your heart, and they can help you to time these drugs very well so that these drugs tomorrow will not have an effect on your heart. On a plain echo, I can know the biochemical changes inside the body. Like you have a low sodium, you have a high potassium, you have a kidney failure, you have a stroke, and so many things inside your body. Friends, with echo, you can see your heart yourself. If I show you exactly what is wrong with a particular valve or particular point inside your heart, don't you think you will be in a much better condition to understand that problem and to take care of it perfectly? Friends, echo is so easy to do. No side effect. You can keep on doing it a number of times. You can keep on repeating it with better expert. You can send the CD that you have done it to any expert in the world, and you can get a much better opinion on that if you want. So friends, what you should do before any major procedure on your heart, see that your doctor does an echo on you and gives you the condition as to where you stand. And taking use of echo, you will be able to be having a much better health. So my friends, go ahead and live the beautiful life God has gifted us on this earth. Thank you so much.